So the entire session will be recorded as well, and we will be posting the link on Facebook page also, so that people can join in from Facebook as well. Page also, so that people can join in from. Yeah. So fine. Yeah. So welcome all to the today's session, and thank you so much again for joining us today. And what I will do is just let me post, as we have several doctors waiting on the Facebook also. So just give me a minute. We will be posting the like we are already live on our YouTube channel. So we'll be posting the YouTube link to our audience on Facebook as well. Yes, fine. So thank you all for joining today, and again we will be having a very good session. So welcome all the doctors and students who have joined, and there will be, I can say, a path-breaking session today. You all will be witnessing, because when I attended, and in fact when I met Dr. Anurag first time, so I was having this perception in my mind. I think आप सब लोग mostly आयुर्वेदा से हैं, एंड आप सब के माइंड में टॉपिक को देख के पहला क्वेश्चन यही आता है कि डायबिटीज की जहाँ तक हम बात करते हैं, इन आयुर्वेदा डायबिटीज हैज मेंशनड एज नॉन क्योरेबल या असाध्य, या वी कांट रिवर्स डायबिटीज. सो द फर्स्ट क्वेश्चन इन माय माइंड वाज दैट ओनली, that we can't cure, or we can't reverse, or we can't say that we have remitted the diabetes from a patient's body 100%, and they can eat sweets, sugars, and technically they are free from diabetes. So that was my first thought when I met Dr. Anurag. Let me be very honest. And he is an allopathic doctor by background. However, by virtue of his some personal experience, which he will be sharing with us today, he ventured out, and he is now exploring so many dimensions about Ayurveda, which you will get to know in his talk. So let me first of all introduce Dr. Anurag Singh to all of you. And so that was my question. And when I met him, when I understood about his theory, the concepts, and when I have seen some real-time examples and real-time patients which he has healed, so the confidence got increased, and right now I can say, like, without any doubts, and already referred and already working closely with him as a team member in helping patients, and several doctors also who were suffering from this deadly disease, that is diabetes. And as we all know, diabetes itself is not that deadly, but the impact it gives to our body is devastating. In fact, in the recent times, we have seen that people who were suffering from diabetes are more at risk in terms of the hospitalization, or getting into the critical situations as far as the COVID infection is concerned. So diabetes affect in every aspect. So, but now I can say, and I clearly, whenever somebody uh, comes with a problem, and the confidence which I got, and we as a doctors can achieve from Dr. Anurag is, we don't consider type 2 diabetes as diabetes, by the way. his real challenge, and he always say that I don't consider type 2 as a diabetes. His real challenge and his real USP, I can say, is reversing the type 1 and withdrawing the insulin levels, or decreasing the insulin level and then withdrawing that completely. So that is the main aspect which we need to understand. So he has been a consultant with various multinational organizations. He has exhaustively worked in the stem cell therapy companies with a core specialization in reversal of diabetes. So he's an ideal, I think, is a combination of all the scientific and modern aspects, as well as the Ayurveda herbs and the Ayurveda treatments which he is infusing as far as diabetes is concerned. India Diabetes Clinic is one of the path-breaking, I can say, platform which he has created, and both type 1 and type 2 diabetes being reversed. And he's having the distinction that so many like patients, if I can say numbers, I think they are in more than thousands now, which eventually have stopped the medicines, and approximately 50% were either medico or related to some medical family also. And he is very much open and always focused on several immune aspects, immunological disorders, chronic diseases, and apart from diabetes also he has several other experiences, which we will ensure that in upcoming sessions we will request him to deliver some lectures and some sessions on those diseases as well, which he is managing. And I can completely understand uh, that there are more areas we can explore with him in terms of getting knowledge. So now, first of all, let's focus on diabetes in today's session. The model which we always follow is, first let's hear from Dr. Anurag, and people who are watching us on Facebook and YouTube as well. You can post your queries in the comment section, and we will take up your questions and queries after his talk and after his presentation. And people who are joined on Zoom, I can see more than 100 doctors are there on Zoom right now. So you can type your query in the chat section and let us know. And accordingly, when Dr. Anurag will complete his talk, we will have ample time today. I requested him to give us some more time in terms of, because this topic will require exhaustive discussion. And what we are planning is, maybe in the next follow-up session of this today's session, we will circulate this video which we are already getting recorded on YouTube. So in all the doctor community, and we will have another session with Dr. Anurag, which will be an interactive session, because more and more interactions, more and more questions, queries, and clarifications is required uh, on this topic, which we feel. So thank you so much, all of you, for joining in such a motivating number, and it's always encouraging. And without wasting much time, I will hand over this session to Dr. Anurag Singh now, and he will take us forward through his scientific journey of how he is helping out people and relieving them from this deadly disease, that is diabetes. Welcome, Dr. Anurag.
Thank you, sir. Thank you so much. Sir, can I start my screen share now?
Yes, we have enabled you.
Yeah, thank you, sir. Thank you so much. So, okay, so we are now talking. I'll just minimize the videos on my screen and I'll start this. So I'll have a brief introduction to what I'm trying to talk about, so that with that brief, I'll keep it short, because of all of us are doctors and we know the science behind what I'll be talking about. So I'll be keeping it simple and short. And if you can post all your queries and your comments in the Zoom chat box, I'll be able to take them towards the end of the session. So, this webinar and this talk is about diabetes reversal and not diabetes management. So, unlike conventional medication available in different pathies, and specifically in allopathy, insulin just reduces blood sugar and increases the peripheral uptake of blood sugar. It helps in blood sugar management. So, blood sugar management and diabetes reversal are altogether different things. So, the main heart of diabetes reversal, that the strategy that we adopt at India Diabetes Clinic, in the first stage, we start our medicine, and at the main emphasis and thrust is to get the patient off insulin and other allopathic tablets or medicines. So you obviously, all type 1 patients are on injectable insulin, and type 2 patients may be on insulin or they may be on tablets. In the second phase, we slightly improve the diet, And in the third phase, we improve the diet to a normal non-diabetic situation, to that of a normal non-diabetic person, and at the same time reduce the dose of our medicine. So I'll share all these aspects in greater detail during the course of the webinar. So, as doctors, we know what is diabetes. I mean, diabetes means high blood sugar, and high blood sugar can happen either due to less production of insulin. So when insulin is unable to, when we have less insulin to transfer the blood glucose from the blood to the peripheral tissues, so either that is the case. So most patients, I mean, all patients of type 1 diabetes have a less insulin production. Some patients of type 2 diabetes may have less insulin production. And the second is insulin resistance. So that means insulin is there, but it's not working efficiently. So whatever be the physical cause, whether it's an infection, whether it's drug induced, whether it's an accident, or whether it's lifestyle, whether it's diet, eventually there are only two biochemical causes of diabetes. So either there is less insulin production, or there is greater insulin resistance. That means the sensitivity of insulin in the body has reduced. So using the formulations that we have, many of which are popularly known to all of you, so we'll see, I mean, why and how we are able to make this treatment effective. We are able to address both these issues of less insulin production by regenerating the beta cells, and we measure that also. And we are also able to address the issue of reducing the insulin resistance. So how do we do this, and what is the process involved? So let's have a look at that. So, the three components of diabetes reversal that we follow and we emphasize on India Diabetes Clinic are happiness index, diet, and medicine. And having said that, I would like to say it's in this order of importance. Happiness index is most important, followed by diet, and eventually medicine. By happiness index, what do we mean? I'll take up all of these issues one by one. In India, in regular life, we feel that, yes, stress management, being happy, yes, hame sab pata hai, tension nahi leni chahiye, so on and so forth. But how many of us are able to approach it and address this issue to make a tangible medical and biochemical benefit in our day-to-day lives within our body, so that we can carry out disease reversal and we can affect the pattern of the progress of disease? It is one of the most underestimated and underrated components of medical sciences and medical physiology in India specifically. Uh, I'll give you a simple example. There is a small child, and he's had a fight with his best friend in school. And his best friend, instead of sharing his tiffin, has shared it with a person whom he does not like. तो एक छोटा बच्चा अपने दिमाग में लेके बैठ जाता है उस बात को 2-2, 3-3 दिन तक. So this is a very simple day-to-day routine example of what happens when we are under stress. This was an example of a child. We can take the example of any example of adults and grown-ups, and in our day-to-day life, the rush life that all of us have. We all know that stress, we all know that tension, we all know that running the rat race of the modern world, what happens to our bodies. We all know what sort of stress hormones and chemicals are released in our bodies, and they have a fight and flight response. So whenever, for whatever reason, our body enters into a fight and flight mode, whether it is at a biochemical level, whether it is an emotional level, whether it's any form of stress, physical stress, emotional stress, biochemical stress, our sugars will spike up. It's an example. There is a boy who I have a patient. He's a class 10 boy. So he is a long distance runner and an endurance runner. So for him, running and training 5 kilometers a day was his regular practice, and it was his meditation. So when he used to go for his evening runs, his blood sugar used to dip. He was really at great joy when he used to practice running. Then his board exams came over. And at the back of his mind, stress of, oh, how will I prepare? And if I spend more time on studies, how will I be able to keep up with my practice? So those thoughts started coming on to him. So that particular activity, which was 5 kilometers practice run, which was actually serving the effect of reducing the blood sugar in him during his board exams and nearing his board exams, his blood sugar used to rise by that activity. So we have to understand and give value to happiness index. And a very simple technique and trick that I give to all my patients is write down 10 things and give them equal importance, give them marks of one by one, and 10 simple things of day to day life that you would like to do that would make you a happy person. And those things should not be connected to, larger materialistic goals of life. It can be something as small as walking on grass, it can be something as small as going out for a long drive, it can be something as small as watching a movie. So, this is a very important and most important component of happiness index, because if at the molecular level we are not happy, if our body's biochemistry is producing stress hormones, so we also know that insulin resistance बढ़ जाती है, and we also know that more insulin will be required, lesser carbs will be required for us to maintain our blood sugar. So happiness index is a very dedicated section, and I advise all my patients to approach this happiness index in a very scientific manner. We have dedicated interactions with all our patients, and we work with all our patients on how to manage their happiness index in a day-to-day life. A country like India, we don't have an happiness index, and a country like Bhutan, that country has a happiness index. Actually, the government of that country is measuring the state of happiness of its citizens. In the modern world, and looking at the rat race of the modern world, and looking at the COVID pandemic, and looking at so many things happening in the world today, so we need to have a dedicated priority to being happy people. Otherwise, stress, gadgets, technology, and the race of the modern world will always keep us on the edge. So that is why more and more lifestyle disorders will start increasing if we don't give attention to the happiness index. The second part of the reversal protocol is diet. And by diet, I don't mean dieting. So what do we understand by diet? So let's have a look at diet section in the next two slides. The first is right education. I mean, many people in India, many people abroad over the world, across the world, we're not aware of, we're not educated about what we're eating. This is just a simple example of three dals, three pulses, urad, arhar, and moong, and we're studying the nutrition facts of those, the serving size of 100 grams. So we are educated and we are told that dal is basically a protein. Yes. So therefore, whenever we eat dal, we feel we're eating proteins. So we have dal with rice, we have dal with chapati in Indian diets. So what do we feel कि अरे मैंने दाल खाई तब भी मेरी sugar बढ़ गई. So we forget that yes, dal is a good source of protein, but did we ask that source of protein, how many carbohydrates does that source of protein have? We forget to ask ourselves that question. And eventually we need to understand that yes, when we were taught in school that dal is a good source of protein, yes, as compared to other vegetarian foods, normally vegetarian foods contain 5% protein. As compared to those, dals contain 20 to 25% proteins. But we forget to ask how many carbs are there. So each dal has anywhere between 50 and 65% carbohydrates. So when we are having dal, yes, we are having more proteins than other vegetarian foods, but we are having good amount of carbohydrates as well. So when we have dal with rice, so this becomes a combination of two carbohydrates. When we have dal with multigrain atta ki chapati, so we are having again a combination of two carbohydrates. So that is why two carbohydrates will become a very potent combination, which will increase and rapidly spike the blood sugar, specifically in diabetics. So this is just an example of how to be educated. We should always look up Google and look at the nutrition facts of what we're eating. For example, I told one of my patients to have a low carb dinner. So he started having chicken for his dinner. So I started noticing that his blood sugar is rising by 60, 65 points after having his dinner. So on further investigation, when I asked him what kind of chicken he's having, so he told me he's having a chicken sausage. So sausage has a binding material of maida. So without realizing that besides having chicken sausage, he's also having maida, which is used as the binding material in that. So the point comes down to it again and again. We need to be more and more educated about what we're having. What are we putting in the gravy? How many carbohydrates does it have? So on and so forth. And what kind of carbohydrates are there? Is there more roughage? Is there fructose? Is there glucose? And so on and so forth. So being educated about the food that we have or we are eating is very important. For each patient that we take up at India Diabetes Clinic, we spend over 1 to 1.5 hours educating the person. We don't give a printout ki eat this, these are medium, low or high glycemic index foods, because giving a printout, I personally feel becomes very difficult to comply with. So the best is to educate the patient so that the patient can become his own nutritionist, he can become his own dietitian, and everyone has a different lifestyle. So once they are understanding how they have to educate themselves about what to eat, what not to eat, they can decide for themselves as to what their diet should be. So what should be an ideal diet for diabetics? So for diabetics, the ideal diet I recommend in terms of the three parts is carbohydrates, fats, and proteins. It should be a low glucose. By low, I mean low glucose. So fructose is absolutely fine, like apple and pear, because fructose is independent of the action of insulin. Fructose is also a simple sugar. The blood sugar will only temporarily rise for 3 to 5 hours. After that, fructose will be absorbed in the peripheral tissues on its own, and the blood sugar level will fall down. So by carbohydrates, low, I mean low glucose, and they should be fiber rich. The advantage, for example, of a fiber rich diet is that more exercise will be done by your alimentary canal, more calories will be burnt, more amount of glucose will be pulled from the blood to be able to digest that food. So a low glucose, fiber rich diet. In terms of fats, mild to moderate. So we don't want high fats in the diet, simply because if we have high fats, more ketones will be produced. And then ketosis, we know, is one of the recognized complications in all diabetics that we need to avoid. And the proteins can be normal. So in terms of carbohydrates, fats, and proteins, low carbohydrates, low glucose carbohydrates, mild to moderate fats, and proteins can be normal. So the two diet strategies that are there are given in the red boxes. The first and most important thing is shift 50 to 60% of carbs from glucose based carbs to fructose based carbs. Like we all know that both glucose and fructose are simple sugars, but diabetes is a disease of glucose metabolism derangement and not fructose metabolism derangement. Fructose can and is efficiently used by all tissues of the body except the central nervous system, except the brain and spinal cord. All other tissues, the muscles, everything in my body, the gut muscles, every tissue except brain and spinal cord can use fructose equally efficiently as compared to glucose to produce energy. So in the morning, instead of having a paratha made of normal atta or a chila or anything, if I have an apple, so irrespective of whether I'm type 1 diabetic or type 2 diabetic, yes, my blood sugar will rise a little bit, but in 4 to 6 hours, it will come back to normal. And it will be absorbed slowly and slowly in all the peripheral tissues of my body, and it will be used to produce energy. So the first strategy is, let's not compromise on our energy levels. We have to live in the modern world. We have to carry out all our responsibilities. So we need energy. So just shift 50 to 60% of the carbs from glucose-based carbs to fructose-based carbs. That is number one. And number two is post lunch to next day breakfast, stay on low or no carbs. That means the logic is simple. We are having carbs, we are having some glucose-based carbs in the breakfast, we are having some glucose-based carbs in the lunch, but from 2 o'clock or 2:30 till next day 7 o'clock or 8 o'clock in the morning, we are glucose free. We can have fructose in the evening, but by no carbs and low carbs, I mean low or no glucose. We are glucose free because I'll give you an example. Let us say there is a factory in which 100 labor is working to carry out some work. Suddenly, 80 of those people go on leave and 20 are left. But the work that is required is the same as those that has to be done by 100 labor. So what will happen to those 20? So in the morning when 100 लोगों का काम 20 लोग करेंगे, थक जाएंगे बहुत. फिर जब लंच में भी वो 100 लोगों का काम 20 लोग करेंगे और थक जाएंगे. If I give them evening snacks also and dinner also, as it is, my glucose metabolism is compromised. If I overload it with 2 times, 3 times, or 4 times their capability, eventually it will lead to exhaustion and they will have death. So, having a normal carbohydrate diet for diabetics further worsens the biochemical level of severity of the disease, which we don't understand. And we see in hundreds and hundreds of cases why complications of diabetes happens is simply because that we're having normal carbohydrates and we're just managing the blood sugar. So instead of that, if we focus on reducing the glucose, we can increase the fructose. So we are not compromising on our energy. So it is very simple. If I am sleeping 7 hours at night and due to an emergency, I get to sleep only 2 hours, how will I feel the next day? I'll be very tired. If second night also I get to sleep 2 hours, third day I'll be even more tired. तीसरे दिन, चौथे दिन, पांचवें दिन तो मैं चिड़चिड़ा हो जाऊंगा और किसी से लड़ाई झगड़ा भी कर लूंगा. So when will I get relief from it? I will get relief from it when I get to rest or sleep 8 to 10 hours. Similarly, मेरे skin पे cut हो जाता है. My body cells, my skin cells, all tissues of the body are regenerating and degenerating. कट हो जाता है और वो जो पहले ब्लीडिंग में मान लो बंद कर दूं, कुछ दिनों के बाद मैं देखता हूँ खुरंड आ जाता है और कुछ दिनों के बाद वो भी निकल जाता है, लाइट पिंक स्किन आती है, फिर उसके बाद नॉर्मल स्किन आती है. Why does that happen? We are allowing that part of the skin to rest. So if I don't allow the beta cells of my pancreas to rest for over 12 to 14 hours, from lunch till next day breakfast is 16 to 18 hours. By allowing my beta cells to rest, by allowing my beta cells not to worry about glucose coming into your mouth, I am able to kick in a natural rejuvenation by allowing the beta cells of my pancreas to rest. शाम को energy low लगे, please take an apple. That is not rich in glucose. It is rich in fructose, and the fructose in the blood will not cause a load on the beta cells of the pancreas. So we need to remember these few crucial points. Shift 50 to 60% of the carbs from glucose-based carbs to fructose-based carbs, and second, post lunch till next day breakfast be on low slash no carbs. I by carbs here I mean glucose. So this is the basic diet strategy which I recommend for diabetics. And the third was medicine. You know, there are several medicines that are there available. We know many herbs. We know gudmar. This is a screenshot of the website of the United States government. So this is of they have an agency known as the NIH, which is National Institutes of Health. So this is about Gudmar or Gymnema sylvester, and the website link is also given on this page, and I've just highlighted a portion. So Gudmar, it's written, what does the US government say about it? It says it also increases regeneration of pancreatic islet cells to cause what? Enhanced enzyme mediated uptake of glucose. So basically, even the US government is saying if we are using pure good mar, jiski medical potency high ho, we can cause regeneration of pancreatic islet cells. It will result in enzyme mediated uptake of glucose, peripheral uptake of glucose. So basically, beta cell regeneration will happen. So this is just one example. If the formulation that we use has got 18 herbs in it, and we have taken a license from the Ayush Ministry. So this is one example of one herb that I'm talking about. In fact, all of us know that Gudmar ka ye function hota hai. Gudmar is present in all the formulations that are commercially available in the market. So why is it that when we have those formulations, I'm not able to regenerate my beta cells? And how am I claiming to be able to regenerate the beta cells? And how do I substantiate that? I will address after the next slide. This is an example of curcumin. You know, curcumin is obtained from turmeric. And what does again the NIH of the US government have to say about it? So I'll just read this entire conclusion. Recent research has provided the scientific basis for traditional curcumin and confirmed the important role of curcumin in the prevention and treatment of diabetes and its associated disorders. Curcumin could favorably affect most of the leading aspects of diabetes, including, now please pay attention here, insulin resistance. Curcumin is a fat soluble molecule. The curcumin, which is available in the Indian market of the shelves, is made in a water base. In fact, 90% of the drugs, medicines, and supplements are made in a water base simply because 70% of the human body is water, and the bioavailability of most medicines and chemicals which have to be consumed by human beings, if given in a water basic tendency is that easy absorption hoti hai body mein. So therefore, very few medicines and supplements are made in the world which are in a fat base. Now, curcumin being a fat soluble molecule, if we prepare that in a water base, uski absorption hi kitni hoegi? and उसकी फिर action कितनी होएगी. So, we have to always remember this, that for medical effects, we need to have the proper preparation of curcumin with us. Just taking haldi or just taking any curcumin will not cause us to reduce insulin resistance. So curcumin could favorably affect most of the leading aspects of diabetes, including insulin resistance, hyperglycemia, hyperlipidemia, and please pay attention for type 1 diabetics, islet apoptosis and necrosis. So basically, he's talking about cell death, which occurs in type 1 diabetics due to autoimmune reasons also, and other various reasons. In addition, curcumin could prevent various deleterious complications of diabetes despite the potential. So this article was there from the NIH website a few years back. So even this article is highlighting about the preparation of curcumin. Despite the potential tremendous benefits of this multifaceted nature product, results from clinical trials of curcumin are only available in using curcumin to treat diabetic nephropathy, microangiopathy, and retinopathy so far. Studies are badly needed to be done in humans. So after this article was published, there have been some studies that have been done by scientists all across the world. I'll share some of those studies. Studies are badly needed to be done in humans to confirm the potential of curcumin in limitation of diabetes and other associated disorders. Further, multiple approaches are needed to overcome limited solubility and poor bioavailability of curcumin. So these are the challenges that we have been able to surmount. In India, I am afraid that very, very few preparations of curcumin in a fat base are available. At India Diabetes Clinic, we have already contracted a manufacturer in the US. So we have a nano emulsion of curcumin prepared in a fat base, and we are making it, providing it as soft gels. And we've seen, due to the rapid reduction of insulin resistance, that means that due to the high increase of insulin sensitivity, type 1 diabetics के अंदर insulin की injectable insulin की dose इतनी जल्दी जल्दी कम होती है, and eventually they get off insulin as well. This plays a very major role in that. So I'll come to the next thing. So what I was saying, why I've given these two examples of Gymnema sylvester and curcumin. There are many other herbs. There are 700-800 herbs that scientists across the world have studied. So we use a combination of herbs to increase the beta cell regeneration, and we use curcumin to reduce the insulin resistance. At a biochemical level, irrespective of the cause of diabetes, we are able to address the two biochemical causes of diabetes. So let us go ahead and see about a couple of patients who have from both type 1 as well as type 2 benefited from the kind of treatment that we have given. So this is an example of a type 1 patient. So this is a C-peptide elevation in a type 1 diabetic. So we all know that if we do C-peptide at fasting level, we get an assessment of how much insulin our body is producing. So August 2017, this first report is of August 2017, in which the C-peptide was 0.6. They came to us. So he was a type 1 diabetic. He was in class 9, and he's been on an insulin pump since then. So in end of 2018, they came to us. So the only measurement of C-peptide we had at that time was 0.6. That was of August 2017. But by the time they came to us in November 2018, I presume his C-peptide was even lower because of the action of GAD65 and IAA and other antibodies that destroy the beta cells. So within 3 months, so from November 2018 to Feb 2019, the C-peptide increased from 0.6 to 0.94. In June, it was 1.43, which is normal. And in October, it was already 2.75. I'll be sharing a video of this child's mother, and this boy got off his insulin pump in maximum 8 to 10 days. This was a long time back, and it's been over a year and a half. He's off in injectable insulin. In today's time, he's having dal, he's having pastas, he's having burgers, he's having pizzas. He started with our Ayurvedic medicine 2 spoons 4 times a day. In today's time, he's having half spoon or 1/3 spoon once a week or twice a week. So if his C-peptide elevation has happened, his injectable insulin has stopped, his activity levels are normal, his diet has come back to that of a normal non-diabetic kid, his Ayurvedic medicine has also reduced by 80 to 90%, in fact, over 90%. So this is what I call as reversal. If I am to substitute insulin by another preparation or agent or medicine of mine which would reduce, which will increase the peripheral glucose uptake and reduce the blood sugar, chahe main methi dana do, jamun do, kuch do. So, but if that boy remains dependent on it, that is not reversal. So I'll be substituting management with management. But right now I'm talking about reversal here. So we'll see many cases, and we have a couple of our patients also with us. So this is an example of HbA1c reduction in type 2 diabetics. I don't know why we call type 2 patients diabetics, but managing blood sugar and then tackling insulin resistance is very, very easy comparatively. So in December 2018, his HbA1c was 11.8 when he came to us, and in Jan it came down to 8, and these are screenshots of his reports. By March it was 6, May it was 5.6, and to be frank, I mean, this patient is right now not taking anything. He's working in a school. He's an active person. He's eating normal chapati. He's eating normal salads, dal, sabji, whatever. It's a normal diet and activity level. So let's just see a couple of videos of our patients, and we'll then have an interactive session.
Hello everyone, my name is Ekta and I am from Kota, Rajasthan. My son Kartik is a type 1 diabetic since past 2.5 years. Like all type 1 diabetics, he was on insulin injections in the starting, and later on he started using insulin pump. After 1.5 years, we got to know about Dr. Anurag and we came to meet him in Delhi. After 8 days of starting his protocol of diet and medicine, my son did not need any injectable insulin. He stopped using his insulin pump. It has been 13 months now and he has not needed any injectable insulin. 3 things have really boosted my confidence. Number 1, his injectable insulin has completely stopped. Number 2, his C-peptide has improved a lot, that is from 0.60 to 2.75. Being a type 1 diabetic, this is a proof that my son's pancreas is producing more insulin now. And number 3, his Ayurvedic dose of medicine has also reduced over 80%. So being a mother, I am very happy that my son's sufferings have really reduced. And I am thankful to God and I am thankful to Dr. Anurag.
So this is the testimonial of a patient. She's a doctor in Mewat Medical College and she's a pathologist. So her mother got diagnosed with diabetes and her fasting blood sugar was over 300. Doctor wanted to put her on insulin. So at that time they came to us.
Hello everyone, my name is Dr. Pooja Sharma and I'm working as an associate professor in Department of Pathology at Mewat Medical College. My mother, who is around 68 years old, was diagnosed with diabetes mellitus last year. Her fasting sugar levels were around 300 mg at that time and clinician advised to start with insulin injections immediately. This came as a complete shock to all of us in the family. But fortunately, we got to know about Dr. Anurag's diabetes treatment protocol through some friends. We met him and immediately started with his medicines and recommended diet schedule. Within 15 days, her sugar levels came back to the normal range. Thank God we met him, and on his advice only, my mother was saved from suffering of taking daily insulin injections. It has been a year now, and her sugar levels and all other biochemical parameters are absolutely fine. And all of us in our family are very much relieved and happy with this. I want to share that my mother is eating all the healthy vegetables, fruits, salads, some dals, and that she has only very few minor restrictions in her diet, which we hope shall also decrease with the passing time. I'm very thankful to Almighty God and
So, this was a very brief presentation that we had that I wanted to share with all of you. And if you have any further questions, so please feel free to ask your questions so that whatever remaining time we have, we can keep it interactive. And yeah. And in fact, sorry.
Testimonial, like, do we have people as well with us for sharing live testimonial?
Yes. We have Dr. Sudeep Verma. He is government officer. He is from Lucknow. So if Dr. Piyush, can we unmute Dr. Sudeep so that he can talk about his father who was a diabetes patient? Yeah, Dr. Sudeep.
Yeah. Hi डॉक्टर अनुराग, हाय पीयूष। मैं आप सबको बता दूं कि पीयूष मेरा जूनियर है और हम लोगों ने एक ही कॉलेज से बीएमएस किया है और मैं एज ए मेडिकल ऑफिसर यूपी गवर्नमेंट में जॉब करता हूं। और मेरी डॉक्टर पीयूष से बात हुई तो उन्होंने बताया डॉक्टर अनुराग के बारे में, तो मैंने कहा ठीक है, एक सेमिनार था इन डॉक्टर अनुराग के क्लिनिक पे ही, हमने उसको अटेंड किया। तो उसके बाद कुछ दिनों बाद मैंने डॉक्टर अनुराग से कांटेक्ट किया और ट्रीटमेंट, मेरे फादर को पिछले 15 साल से डायबिटीज थी और मैंने साथ में कुछ डाइटरी कुछ चेंजेस किए थे, जैसे फ्रूट्स और सैलेड का मैंने उपयोग बढ़ाया था फादर की डाइट में। पर कुछ शुगर नॉर्मल तो हुई थी, पर नॉर्मल मतलब कुछ कम तो हुई थी, पर नॉर्मल रेंज में नहीं आ रही थी। और जब हम उसका मतलब वैसे हम देखते थे फास्टिंग और पीपी कभी कभी ठीक आती थी, बट अगर एचबीएमसी कराते तो बड़ा हुआ निकलता था, नॉन डायबिटिक, और वो बैड कंट्रोल में दिखाई देता था। फिर मैं डॉक्टर पीयूष से बात करी, डॉक्टर अनुराग से बात करी और फिर मैंने ट्रीटमेंट स्टार्ट किया। तो अब मैं यहाँ पे देखिए दोनों लोग हैं, डॉक्टर अनुराग में डॉक्टर पीयूष है, तो मैं बहुत कुछ सही बात बताऊंगा क्या क्या हुआ था, ठीक है। और हुआ क्या कि मैंने ट्रीटमेंट स्टार्ट किया, ट्रीटमेंट स्टार्ट करने के कुछ दिनों तक तो शुगर फ्लक्चुएट करने लगी। तो फिर मैंने डॉक्टर पीयूष को कांटेक्ट किया, मैंने कहा पीयूष यार शुगर कंट्रोल नहीं हो रही है और ट्रीटमेंट थोड़ा कॉस्टली पड़ रहा था मुझे बिकॉज ऑफ द कोविड एंड ऑल। तो पीयूष ने कहा डॉक्टर बॉस आप एक काम करो, आप उनका वो सी पेप्टाइड वगैरह करा लो, और 1 महीना हो गया ट्रीटमेंट करते हुए, अगर थोड़ा बहुत इंक्रीज हुआ है तो आप ट्रीटमेंट चालू करना। वैसे मैंने उससे पूछा कि यार तुम्हारे जो तुम्हारे फ्रेंड वगैरह जिन्होंने ट्रीटमेंट लिया है कैसा रहा उनका ट्रीटमेंट? कह रहे बाकी सब लोग, मेरे जितने लोगों ने लिया है उन्होंने सबने बताया कि ट्रीटमेंट अच्छा है और रिवर्सल हो जाता है, बिल्कुल ठीक हो जाते हैं। फिर मैंने सोचा कि ठीक है, जब 1-1.5 महीने मैंने ट्रीटमेंट करा लिया है तो और जस्ट गिव इट ट्राई, 1 महीने और कराता हूँ मैं। फिर मैंने डॉक्टर अनुराग से बोला, डॉक्टर अनुराग ने फिर स्टार्ट किया ट्रीटमेंट। और फिर उसके बाद अब तो खैर शुगर हमारी बिल्कुल, मतलब फादर की शुगर बिल्कुल नॉर्मल रेंज पे आती है, 91, 95, 99, कभी जब कुछ खा लेते हैं। अब तो खैर वो शाम को कभी कभी केक पे, जब 7 तारीख को उनका 7 अगस्त उनका बर्थडे था, 65th बर्थडे था, शाम को उन्होंने केक भी खाया, तो केक खाने के बाद भी उनका शुगर 99 आई थी। तो ये बड़ा अच्छा रिस्पॉन्स रहा है मेडिसिन का। और अब तो डोज भी कम होने की कगार पे है, मतलब जो हम लोग पहले एक स्पून लेते थे 4 टाइम्स, अब हमने हाफ स्पून, मतलब 2/3 स्पून इन द डे टाइम और हाफ स्पून इन द नाइट कर दी है। तो थैंक यू डॉक्टर अनुराग, थैंक यू पीयूष।
एंड सर आपसे मैं एक चीज पूछूंगा, अंकल को आम खाने का बड़ा शौक है, तो आम को खा लेते हैं ना?
आम खाते हैं वो, मतलब कि आम खाते नहीं, आम भी खाते, साथ में उनको खाने का शौक है वो मुनक्का और क्या ना वो अंजीर ड्राई फ्रूट। तो वो बेसिक बहुत दिनों से कह रहे थे, मैंने कहा पहले डाइट कम होने दो, अब डोज कम हो गई, तो वो मुनक्का अंजीर भी रोज खाते हैं।
So if I'm understanding, over a period of few months, एक तो आपकी मेडिसिन डोज रिड्यूस हुई एंड डाइट फ्लेक्सिबिलिटी धीरे धीरे,
डाइट फ्लेक्सिबिलिटी, जो मैंने बताया ना कि 7 तारीख को उनका बर्थडे था, वो केक भी खा रहे हैं, कभी कभी उन्होंने, अब वो खाना खाने के बाद आम भी खाते हैं, आधा आम भी खाते हैं, और कार्बोहाइड्रेट भी ले रहे हैं, मतलब जैसे सब्जी में पहले आलू परवल सब्जी में परवल खाते थे, आलू नहीं खाते थे, और अब आलू भी खा रहे हैं साथ में। और खैर हमने ना आटा अभी नो कार्ब जो आटा होता है, कीटो आटा, वही चालू कर रखा है, अभी नॉर्मल आटा गेहूं नहीं देते।
राइट सर, थैंक यू सर, थैंक यू सो मच।
थैंक यू।
We have Dr. Vivek also from Himachal with us. So sir, can we unmute Dr. Vivek? Yeah, hi Dr. Vivek. So can we unmute Dr. Vivek? Just a second, I will. Sir, I'm unable to unmute Dr. Vivek. He is diabetic himself, so I would really like to hear what he has to. Sir, can you try and unmute yourself, Dr. Vivek?
Yes, sir. Hello.
Yeah. So can you please share your journey, since when are you diabetic and what were your parameters like before you, and when have you started taking a treatment and how are you today?
सर नमस्कार, सबसे पहले तो सबको मेरा नमस्कार। मैं लास्ट 2017 से डायग्नोज हुआ था डायबिटिक। और मैं फर्दर डायबिटोलॉजिस्ट से कंसल्ट किया और मैंने अपनी डायबिटीज़ की मेडिसिन स्टार्ट की, ओरल हाइपोग्लाइसेमिक ड्रग्स एंड अनदर। बट मेरी डायबिटीज़ और जो मेरी फास्टिंग ब्लड शुगर लेवल था और अनदर जो पीपी HbA1c सब बहुत ही, मतलब जिसको बोलते हैं भाई, समझ नहीं आ रहा था कि मैं करूं क्या।
सर आपकी फास्टिंग कितनी थी?
फास्टिंग आई थिंक मेरी 190 से भी ऊपर चली जाती थी कभी कभी तो।
ओके सर।
ये लास्ट मेरे को याद है 190 थी लास्ट, मुझे जो याद है।
So when did you start a treatment? How many months has it been?
सर मैं लास्ट फरवरी 2020 में आपके पास आया था। वो मेरे एक सीनियर थे, उन्होंने मुझे आपके बारे में बताया।
Right, right. And how are you doing today, sir?
सर टुडे अभी तो मैं काफ़ी खुश हूँ इन दवाइयों के रिजल्ट देख के। मेरी जो फास्टिंग वैल्यू थी वो अभी 70 लास्ट मैंने रिकॉर्ड की, 70 to 85 मेरी फास्टिंग, और पीपी मेरी 130। और हाँ, अभी मैंने कल अपना HbA1c करवाया, तो लास्ट जब मैं फरवरी में सर के पास गया था देन आई थिंक 9 के पास था, बट अभी 5.4 माई HbA1c।
सर
तो मैं
डाइट
काफ़ी
में
खुश भी।
सर डाइट में कुछ रिलैक्सेशन हुई आपकी? जैसे आटा, पहले आप मल्टीग्रेन आटा लेते थे, फिर मैंने बीच में कीटो आटे पे रखा था, एंड
जी
आपकी
जी।
डाइट धीरे धीरे हो रही है इम्प्रूव?
अभी मैंने एक चपाती रात को लेना स्टार्ट की है 2 दिन पहले, और अभी काफ़ी इम्प्रूवमेंट है।
एक्चुअली मैंने डॉक्टर विवेक को हमेशा कहा था रात को एक रोटी लिया करें, ये अपने आप ही नहीं रोटी ले रहे थे। सो मैंने इनके ऊपर जबरदस्ती करनी पड़ी कि आप प्लीज रोटी वगैरह स्टार्ट करो रात को, बिकॉज नॉर्मल न्यूट्रिशन की भी जरूरत होती है। तो आई वुड
जी
लाइक टू शेयर विद ऑल फ्रेंड्स हियर कि इट्स नॉट अ डाइट रिस्ट्रिक्शन, देयर इज नो डाइटिंग एज सच, सिर्फ डाइट मैनेजमेंट होता है, कब खाना है, किस कॉम्बिनेशन में खाना है, किन चीजों के साथ खाना है, दैट इज द ट्रिक ऑफ इट। सो हाउ हैज योर एक्सपीरियंस बीन, सर?
सर, मेरा एक्सपीरियंस स्टार्टिंग में तो मुझे डर भी लग रहा था, जैसा अभी सर बता रहे थे कि ट्रीटमेंट एक्सपेंसिव है। बट अनुराग सर को मैं रियली थैंकफुल हूँ, उनका ये काफ़ी कोऑपरेट भी करते हैं। और अभी जो मेरा एक्सपीरियंस है कि मैं फरवरी से लेके अब तक मैंने रात दिन का फर्क देखा है अपनी शुगर वैल्यू पे। सो आई एम थैंकफुल टू डॉक्टर अनुराग। अभी
थैंक यू सर।
ट्रीटमेंट कंटिन्यू है, अभी आगे देखते हैं।
Thank you, sir. Thank you.
Okay.
So, Dr. Piyush, is there any specific question that any of our members has?
Sir, actually, you wrongly mentioned any. There are in fact many. So, and first of all, thank you so much, Dr. Sudeep Verma, for joining us today. As you said, Dr. Sudeep is my senior. In fact, थोड़ा सा वो बॉस ने politely उसको mention किया because all of you are seeing us live, but मैं थोड़ा सा उसको बड़ा honestly put up करता हूँ। एक बार को he was like also thinking कि maybe discontinue करते हैं और इतना result नहीं आ रहा है, एंड वो हो जाता है, वो नेचुरल है, बिकॉज सी ये प्रॉब्लम ऐसा है, दिस डिजीज इज लाइक दिस। हम एज ए डॉक्टर्स कई बार कॉन्फिडेंस लूज कर जाते हैं और फिर वो एक बन जाता है टू टेकन फॉर ग्रांटेड कि चलो डायबिटीज ही तो है, चलो थोड़ा बहुत ही तो शुगर लेवल 50 ही तो बढ़ा हुआ है, क्या फर्क है। आई थिंक हमारे डॉक्टर्स में से ही काफ़ी हैं जो अभी क्वेरीज भी आ रही हैं, दे मे बी दे आर देमसेल्फ और देयर फैमिली मेंबर्स आर सफरिंग, बट आई थिंक हम सबको ये जानना चाहिए कि डायबिटीज इज itself is not that harmful, but जो बाकी organs पे and quality of life पर it hampers, as Dr. Sudeep mentioned about his father. I have seen so many patients who are not eating sweets or eating these kind of food because वो कहीं ना कहीं hamper करेगा उनका healing and management को. So you can imagine the quality of life or the feeling which we can provide to them if they are able to eat these kind of stuff like cake or sweets or that thing after so many years of their life, because those especially who are on type 1 or uh, complicated stages of type 2, वहाँ पर काफ़ी challenge है. So without I think wasting much time, let's me start the questions. There are so many questions as well as like on Zoom as well as on YouTube. Uh, so let me start by one, and I request all of you who are seeing us live on YouTube also or Facebook, you can post your question there. I will just pull out some questions from there as well. Right. So, sir, several doctors are asking, can you throw more light on the carbohydrate management which you have discussed in your presentation? So just to specifically mention, or maybe giving some tips that how to a patient, if we have a patient with us as far as diabetes is concerned, what kind of carbohydrate or specifically diet management, you have already mentioned several aspects in your presentation. Still some more tips and some more clarifications which you can maybe share, or in a nutshell you can explain
Yeah.
for our management.
So okay, so few tips I will give is कि for example दाल ले सकते हैं, दोपहर को लेना है, रात को नहीं लेना है, क्योंकि दाल को अब हम कार्बोहाइड्रेट मानेंगे। हमने एक टिप बोली थी पोस्ट लंच टिल नेक्स्ट डे ब्रेकफास्ट बी ऑन लो स्लैश नो कार्ब्स। तो दाल ले सकते हैं लेकिन डिनर में नहीं लेना है। इंडिया में काफी जगह पे दाल डिनर में लेते हैं, सो हैव दाल एट लंच एंड नॉट एट डिनर। नंबर वन। अनदर एग्जांपल, have one carbohydrate which is having glucose at a time। लंच में चावल ले सकते हैं लेकिन चावल को दाल के साथ नहीं लेना है। दाल चावल is a very common combination in India, so you can have चावल, you have rice, you have it with gravy vegetable, you can have dal also, but you can have that with a low carb flour। कोई कीटो फ्लावर लें जिसके अंदर फैट्स भी माइल्ड टू मॉडरेट हो। so I recommend 2 or 3 varieties of keto flours that are there in the market। no particular brand is better than the other, there are a few good brands, but the thing is that always remember जो भी चीज लें उसके अंदर फैट कंटेंट माइल्ड टू मॉडरेट हो, हाई ना हो। क्योंकि जो भी आप कीटो प्रोडक्ट लेंगे अगर जो हाई फैट होगा तो उसके अंदर कीटोन्स बनेंगे विच इज नॉट गुड फॉर अ डायबिटिक। सो यू कैन हैव दाल आल्सो, यू कैन हैव चावल आल्सो, you can have almost everything, but in what combination to have and how to have। Another tip which I advise to all my patients is that you should have a large bowl of green salad 1 to 1.5 hours, preferably before lunch। Now, in green salad, I mean sprouts are totally out। I don't include sprouts। खीरा ले सकते हैं हम क्या कहते हैं, खीरा ले सकते हैं हम, टमाटर ले सकते हैं। अब ग्रीन सैलेड का लॉजिक 1-1.5 घंटा पहले लार्ज पोर्शन का क्या है, बेसिकली ग्रीन सैलेड विल कंटेन अ लॉट ऑफ फाइबर। तो 1-1.5 घंटा आपका पूरा एलिमेंट्री कनाल उसको प्रोसेस करने में, डाइजेस्ट करने में बहुत कसरत करता है। तो जब एलिमेंट्री कनाल पूरा कसरत करता है उसको डाइजेशन प्रोसेस करने में, ब्लड शुगर खींचता है, आपकी गट मोटिलिटी अच्छी होती है और वो ब्लड से शुगर खींचता है so that it can carry out that gut motility। So have high fiber food which is low in glucose। I mean, so a salad is a it's a diabetic's best friend। So simple educational tips like how sprouts contain या तो चने के होते हैं या दाल के होते हैं। Now they are high glucose। We have to remember they may be having other properties of a salad, but they're also high glucose। So we have to avoid 2 things of glucose together। चपाती के 4-5 ब्रांड्स हैं। कीटो फी का भी एक आटा होता है, न्यूट्री एक्टिव का भी एक कीटो आटा होता है, लो कार्ब आटा, आलमंड आटा भी होता है। घर पे भी आलमंड आटा बना सकते हैं। सो देयर आर डिफरेंट, टेक अ लो कार्ब चपाती, यू कैन हैव वेजिटेबल्स विद इट, यू कैन हैव वेरियस थिंग्स विद इट। आई मीन दोपहर को 1 सब्जी, 1 दाल, 2-3 चपाती ले ली, रात को 2 सब्जी वो ले ली और चपाती ले ली। कोई नॉनवेज हो तो रात को नॉनवेज ले सकता है सौते वेजिटेबल्स के साथ या चपाती के साथ। सुबह कोई स्टफ्ड पराठा भी ले सकते हैं। स्टार्ट योर डे विद अ बाउल ऑफ फ्रूट्स। आधा सेब हो गया, थोड़ी-थोड़ी चीजें हुई। अवॉइड फॉर द फर्स्ट मंथ banana, avoid mango for the first month। Otherwise, second and third month onwards, we can start in little quantities। Have a fructose-based fruit in the morning before breakfast। You can have eggs। तो कोई डाइटिंग नहीं होती, बट यू जस्ट हैव टू इंटेलिजेंटली ईट in different combinations। That is what is important। So what we do at our end at India Diabetes Clinic is that we have a dialogue with the patient, we understand what that patient eats। तो हम उसी के खाने के permutation combinations suitable for him उसको वापस propose कर देते हैं। And जो भी mid meal snacking की चीजें होती हैं, we have to be very careful about that। So fortunately that there are a lot of things available in the market which are good for diabetics, which are keto snacks। अश्वगंधा की काफी अच्छी ड्रिंक्स आती हैं which are absolutely zero glucose, बिल्कुल शुगर स्पाइक नहीं करती। So there are many brands which have many good keto snacks which are friendly for diabetics and good juices। तो एक there is an ashwagandha drink called शून्य। I have no interest with that, but वो बच्चों को पीने के बाद लगता है कि एक मीठा फ्रूट जूस पी रहे हैं। So similarly, there are many colas which are based on ashwagandha and which don't spike your sugar। So, I mean, you can have anything. Be very particular about what snacking you're doing। Have a large portion of salad 1.5 hours before your lunch। preferably before lunch, and be low on glucose after lunch till next day breakfast. So these tips will really go a long way in the reversal process.
Right, sir. So also one more aspect, I was just going through all the chat comments. Let me clarify and let me tell you, all of you, see, there are two aspects of seeing this entire session and seeing this talk. As far as Dr. Anurag is concerned, he has done an exhaustive research, as we can know, and he has developed certain formulations which he is using for the treatment. As you, many of you are requesting, I will also request Dr. Anurag to share as maximum possible about the formulations and about the ingredients or the herbs he is using for type 1 and type 2. For any organization, any group, and we have seen so many companies. As a doctor, we are also using so many companies, and they are using several proprietary products. So it is not a directly advertisement kind of thing which we want to intend. We just want to share the concept and the aspects with all of you, that as a doctor, how you can manage. If you have that bandwidth and if you have that scope to get a good quality gulmar, to get a good quality curcumin, you can always do that on your own as well. So our intention is not to um, advertise anything. However, as a busy clinician or as a maybe a person involved in so many aspects, like for example me, I don't have that time or bandwidth to develop these kind of products. So I always refer patients who want to reverse their type 1 or type 2 to Dr. Anurag, or I sometimes work closely with them as a team member, taking some Ayurveda aspects in the entire management. So my request to all of you is, see, the intention and the reason of doing this session was to give you a concept, to give you an idea. If you have that bandwidth, you can develop your own products. That is always welcome, and please share with us so that we can share with the entire fraternity. And on that note, I would like to request Dr. Anurag, that many doctors are asking about the uh, treatment protocols for type 1 and type 2, with whatever the ingredients and the products which you are using, and the formulations which you are using, and at whatever extent you can reveal and you can share with us. Please, we need to get more clarity on those aspects with you, sir.
So, okay. So as far as the formulation is concerned, I'll share first is that we have obtained a license of our formulation from Ayush. So to cut the long story short, I will share the ingredients of our license with you, and you can post it on the Facebook page so that all of us can see, and including the composition of what I have. Now, having everything that I have, none of the information about the protocol that I use or is a new discovery by me. All information is scientific information available in the open public space in the scientific fraternity. Now the key lies, now why is this working and maybe some other things are not working to reverse diabetes? To come to that, to hit the nail on the head. Now the thing is कि I'll give you an example. मेरे घर के आंगन में एक तुलसी का पौधा है, तो मैं उसकी पत्तियां लेके चाय के उबलते हुए पानी में डालता हूँ, और मुझे लगता है कि उसके मेडिकल बेनिफिट्स मेरे को मिलेंगे। मैं ये भूल जाता हूँ, मैं लगता है कि मैं उसको वाटर कर रहा हूँ, डीवीडिंग कर रहा हूँ कि इट इज ग्रोइंग ऑर्गेनिकली एंड इट इज प्योर, इट इज मेडिकली पोटेंट। मैं भूल जाता हूँ कि जमीन के नीचे देयर इज नो बाउंड्री वॉल, एंड 1 किलोमीटर दूर एक नाला भी है, तो धीरे धीरे उसकी कंटामिनेशन पूरे सराउंडिंग एरियाज में भी गई होगी। नंबर 2, नंबर 3 is कि air pollution in a city. I am based in Delhi, so air pollution in Delhi is so high. अब मैं यही पौधा अगर जो उठा के कहीं हिमालय में या कहीं प्योर जगह पे जहाँ पे वातावरण भी अच्छा हो, सॉइल भी प्योर हो, तो क्या कहते हैं, तो देन द medical potency of the beneficial molecules and chemicals in that plant itself will change. So number one, as a person I feel, मैं इंडिया में हूँ, मैं सारी हर्ब्स या तो मैं केरला से सोर्स करूँ या हिमालय से सोर्स करूँ, एंड बहुत अच्छी पोटेंसी होएगी। आई हैव पर्सनली विजिटेड लॉट्स ऑफ pharmaceutical companies, land as well as manufacturing plants in Himachal and in other areas. So the thing is that we must understand from a very rational basis, without any bias, that there are lakhs of herbs in the world. All herbs cannot grow best in medical potency on the same soil and in the same climate. कुछ herbs इंडिया में grow होंगी, कुछ मलेशिया में ग्रो होंगी, कुछ यूएसए में ग्रो होंगी, कुछ साउथ अमेरिका में ग्रो होंगी। सो There are about 18 herbs in our formulation. I will share the entire Ayush license copy with composition and the names of the herbs with Dr. Piyush, and he can share it on Facebook. So I'm totally open to that. As far as that question goes, that will be addressed. So the idea is that Gudmar grown anywhere, for example, and then there are all the other herbs, that itself is not sufficient. We have to identify the best soil for which herb and the best climatic condition for which herb. Herbs are finite quantity. Herbs are living organisms that grow on a finite quantity called land. मेरे को आज सर में दर्द है, मैं एक सेरेडॉन खा लूंगा. मेरे घर में पांच कोई फंक्शन हो या 100 लोग आए और सबको सर में दर्द हो जाए, मैं 100 टैबलेट सेरेडॉन की मंगा लूंगा. Those are synthetic drugs made in a factory on demand, and it can be multiplied. Now, herbs' medical potency cannot be multiplied. We have to please understand that. And one more trend in the modern world is that we are very finding it very convenient to take pills. All of you are, many or most of you are Ayurvedic doctors. We know कि powder के अंदर एक चीज किसी चीज में मिक्स करके देते हैं, उसकी पोटेंसी क्या होती है, और उसको पिल में बना के दे देते हैं. So popping the pill becomes easy for the patient, but उसके अंदर कितनी पोटेंसी रहेगी ड्रग की, कितनी गम होगी, कितनी चीजें होंगी, और उसके हम इवेंचुअली थेरेपी लेवल तक कैसे ले जाएंगे. So here we are giving only powdered formulation, though some patients want to put it in empty capsules, gelatin capsules, and take them, but the efficacy really goes down. So we have limited patients. We can't look at more than 100-150 patients per month, because the purity of herbs, अगर जो मैं बोलूं मेरे पास 1000 लोगों का स्टॉक है, और कल को अगर जो मेरा काम बढ़ जाता है, मैं कल बोलूं मेरे पास 10,000 लोगों का स्टॉक आ जाएगा, जमीन तो उतनी है जहां से मैं सोर्स करता हूँ. तो या तो मैं 2 मीटर की जगह पे आधे मीटर पे ग्रो करना शुरू करूंगा हर्ब्स को. अगर जो ऐसे करूंगा तो then the potency of the plants which I will be growing and the chemicals extracted from them will reduce. So out here we really not compromising on the medical potency of the sourcing of the herbs that we are using, so that is of great emphasis. Similarly, the curcumin that we use is made in a fat base. It's as a nano emulsion. उसकी absorption 100% होती है. उसकी absorption 100% होती है, तो एक्शन भी 100% होता है. कोई भी ट्रेडिशनल कुरकुमीन हम मान लो यूज करते हैं जो मार्केट में रेडली अवेलेबल है, वी गो टू अ लोकल केमिस्ट, 1000 mg की भी मिलती हैं, XYZ, so we will notice that खाने के बाद हमें एसिडिटी के बहुत कॉमन साइड इफेक्ट एंड ऑप्शंस होते हैं. जब वो अब्सॉर्ब ही नहीं होएगी इतने लंबे टाइम तक, बिकॉज इट इज मेड इन अ वाटर बेस, तो एसिडिटी होएगी, साइड इफेक्ट्स भी फिर बढ़ जाते हैं. We must understand and be educated about the process, the herb, the potency, the purity, without any bias, without any personal bias, without anything. I am an allopathic doctor, but I am trying to share a scientific rationale of using Ayurvedic herbs. The confidence with which I can talk about these herbs reducing the blood sugar and reversing the diabetes is much more than the confidence that I can say insulin will bring down your blood sugar, but after a level, insulin that you are taking in the form of injections is synthetic insulin. It is not the same as injected. It's not the same as natural insulin. So after many years, the time will come when you will slowly and slowly develop insulin resistance. So we must understand the rationale behind all of this. Everything in your body is living. Your pancreas is living. Your beta cells is living. What will happen if something comes into your environment? So the potency of herbs is very important, and that is the game changer. The formulation of curcumin, of how you're using it, is very important. There are so many patients. Curcumin, in fact, there have been some trials done during the COVID pandemic. So if you give me a minute, can I share a web page? I have opened a web page. I would like to share about curcumin and COVID also.
Yes, sir. Yes, sir. Please.
So I'll just share a web page. It is from the internet only. So this is a study which has been done about potential effects of curcumin in the treatment of COVID-19 infection. So long story cut short is that the COVID-19 outbreak is an ongoing pandemic caused by severe acute respiratory SARS-CoV-2 with considerable mortality. The main clinical manifestation is respiratory symptoms. Other patients develop cardiovascular, renal complications. Curcumin are natural, this compound, so on and so forth. In this study, we review this. So eventually, I will just open the whole study. This is just an abstract of it. Just give me 1 second, sir. There are so many studies. Yes, this is a US government link. Sorry, I wanted to open this link. I opened a wrong link. Just a second. Just give me 1 second, sir. So, sir, I'll share that link for you to post on that. So, long story cut short, what I'm trying to talk about is that there have been trials which have been done in the US by the US government, in UK, in West Asia, and Europe. Curcumin, if made in the proper base and if its efficacy is drug delivery system is attended to properly, it is the strongest natural agent for building immunity against COVID-19. In homeopathy, we give camphora, we give arsenic. Allopathic doctors say कि आप zinc लो, vitamin C लो. Long story cut short, whichever patient of mine has been taking curcumin, with diabetics being already a high risk category of patients for COVID-19, not one of them have had any problem. So we have got several studies carried out by scientific fraternity which go to the extent of saying that curcumin is the best drug possible, best synthetic supplement, best natural supplement, possible, which will help in the treatment as well as prevention of COVID-19. And for diabetics, it is a boon because it reduces insulin resistance also. So I will share those studies with you also, sir, and please share them with everyone. Just type curcumin and COVID-19 in Google and you will see in front of you will get hundreds of articles.
Right, sir. So also many doctors are asking your contact details, and let me clarify again. There are a couple of aspects which are mentioned in the chat. So let me clarify that. See, there is always a problem as far as the mindset is concerned. However, there is a solution in that problem as well. We need to understand, and if we see the model many countries are having, for example, China, uh, there the allopathy doctors as well as the traditional Chinese medicine doctors work together to develop the entire system as a holistic system, and they for each and every aspect, they always complement each other. We have seen in several cases of COVID as well. And right now, they are the largest supplier of TCM, that is traditional Chinese medicine, to Brazil and other countries also. However, the mindset in India is many allopathy doctors are criticizing Ayurveda and vice versa. Now, there are very few doctors like Dr. Anurag who are having positive mindset. However, we have seen in past there are several other allopathy doctors or other pathy doctors also, but they are abusing or misusing Ayurveda maybe for their commercial interest. They are just marketing some products directly. I have seen and I have criticized. We have criticized on our platform also. So they are just propagating either their name or either their brand, and they are just abusing or misusing, or I can say not correctly using the Ayurveda protocols of management. Now, in the case of Dr. Anurag, I think the first day when they thought and started to start this treatment, as far as their patients are concerned, they first of all contacted and I was fortunate enough to get in touch with their team. So they always follow this protocol that with an Ayurveda doctor, with an Ayurveda physician, they need to take it forward in terms of the medical management is concerned, and any other aspect is concerned, and they respect and they equally I can say value. You can visit the website and you can visit the company website and all, and you can see that my presence is also there equally with the other doctors and including Dr. Anurag. So I think that mindset we need to appreciate and that mindset we need to encourage. And if we have more and more allopathy doctors like Dr. Anurag propagating and cumulatively taking the scientific aspects with the Ayurveda treatments, I think this will be one of the need of our which we need to understand. And I request all the Ayurveda doctors and students listening to this session also, please come forward from that mindset, and let's integrate and let's collaborate with the doctors like Dr. Anurag to take it forward. Now, let me just take some more questions, and I request. Okay, so Dr. Anurag has shared his detail. Let me just post it for everybody. I think he has shared with me only. So I'm sharing Dr. Anurag's detail on chat, and you can. And there is one issue. I think virtue of his location. So sometimes he's not directly available on the call. So it's always better to send him a WhatsApp message or an email, and then maybe you can connect with him. Which I also feel sometime maybe due to some bad network he is having some issue in the direct call aspect. Now, as far as some more queries are concerned, Dr. Anurag, people are also asking that as far as these artificial sweeteners is concerned, sucrose or maybe like other artificial sweeteners, then the herbal sweeteners like stevia and all. So
Right.
how you recommend, and what is your take on these artificial sweeteners?
I just recommend stevia for my patients, and stevia का एक particular taste develop काफी लोगों को हो जाता है. So in very rare cases, as an occasional exception, I allow the use of azithrol. So otherwise, my recommended sweetener, which I say, is take stevia only. And sir, actually, कुछ time की बात होती है. After a few months, you can start using your normal, in small portions, the मीठा of your foods. तो 2-3 महीने के बाद जब बच्चा या पेशेंट मैंगो शेक भी पी लेगा, तो फिर आर्टिफिशियल स्वीटनर्स की डिस्कशन की फिर बात
बात
होती है थोड़ी देर के लिए सर. So, sir, normally I just recommend stevia for that phase in which I say cut down on your sugars if the patient requires. Sir, अगर जो HbA1c 11 या 12 है और बहुत severe case है, तो I will ask the patient to stop and then switch to stevia. But if the HbA1c is between 7, 7.5, even 8, तो वो सिर्फ लो शुगर पे भी नॉर्मल शुगर पे ही कंटिन्यू कर सकता है. So it's not too much of a stress. Sir, अगर जो to be very frank, if I tell my patient कि if I make them extremely strict, give them a very strict protocol कि ये खाना है, ये नहीं खाना है, इस टाइम पे ये करना है, वो करना है, उसका स्ट्रेस ही इतना बढ़ जाएगा कि what happiness index I was talking about, he will not be able to implement in his practical life. So that is the thing, sir. So stevia ही मैं normally recommend करता हूँ.
Right. And sir, as far as treatment again protocol, let me again ask you, and I think several doctors are asking specific line of treatment. Like for example, कोई type 1 का case आएगा, and we understand that there are certain products which you are using. So maybe on a clinical prescription, yeah, like if we say that okay, with how many dose, with how many, which kind of products, like you have this, I think you are using curcumin, you are using gulmar, you are using other herbs also. So if
Yes.
because the audience right now we have are only specifically doctors and students, so if
Yes.
you can maybe reveal and clarify that this will be the treatment protocol, this much of this drug or this herb initially, I can understand there can't be fixed because there are various dynamics for each
Yes.
and every patient, but still broadly if you can clarify for type 1 and type 2 how we need to take it forward.
Sir, actually, the dosage of the protocol of medicine is that we need to, it's the medicine is in the form of a powder, and it has to be mixed with water and had 45 minutes before breakfast, before lunch, and before dinner. And in some cases of type 1 or type 2, we may require a fourth dose before bedtime. So, you can equate this with the 4 injections of one of long acting and 3 of short acting that a typical type 1 patient takes. So this is just a broad guideline. Now, what dosing is required will depend upon the C peptide, it will depend upon the insulin resistance, it will depend upon the HbA1c, it will depend upon that individual person's metabolism. So normally what we do is we look at the past track record. On an average setting is, sir, ki half to 1 tablespoon of medicine mixed in a glass of water, which is about 200 ml, 45 minutes before meals. That is the standard medicine-wise protocol. In terms of diet, the thing we say is कि breakfast में carbs low, but only 1 glucose. Lunch में भी carbs low, only 1 glucose. After that, evening में कोई carbs की requirement हो तो apple लो या कोई fructose based carb लो. Glucose based carb lunch के बाद next day breakfast तक मत लो. So in terms of medicine and diet, this is what we recommend. We highly recommend to keep a relaxed lifestyle. We highly recommend to be happy and involve oneself. That's a very crucial part. So happiness index is first, diet is second, and then is medicine. So 1 spoon or half spoon 45 minutes before meals. If required, a fourth spoon, which we can determine only by C-peptide value, insulin resistance value. So insulin resistance ke baare mein I'd like to share the popular labs. They have a HOMA IR index, which they use. But in that, they use only fasting serum insulin and they use C-peptide. Now, that's a very insufficient data to measure insulin resistance. So to measure insulin resistance, we need both fasting serum insulin and PP serum insulin, and we need the C-peptide. Then we can get an accurate assessment of insulin resistance. So taking all these tests, we have to review the past sugars and HbA1c of the patient based on his diet also, कि उसने किस diet पिछले 2 हफ्ते में क्या sugars थी उसकी, and उसके इन सारे values क्या हैं, we determine the dosing and we are able to micromanage in first 2-3 days itself, and within first 1 week you will see significant change. 80% of the patients get off their insulin in the first 1 or 2 weeks itself. I'm talking about type 1. Type 2 though is very easy to do. Sir, you're on mute.
Yeah, sorry. So as we are saying that this scoop or this powder which you are again and again talking about, just want to clarify, and maybe it's not for for the audience. Uh,
Yes.
they are asking, but exactly the herbs. Maybe we will share the details with them. But
Sir,
still, if right now you can say that what kind of herbs are there in that powder.
I will just, I'm taking out the list and sharing it with you right now. Just give me 1 second, sir.
So maybe you can just type in the chat box so that I can share with all the audience.
I will just do that, sir. I will just do that.
And meanwhile, we have Dr. Anup Gupta as well. He's the secretary of NEMA Noida. He's a very senior doctor practicing from last so many years. He is also our beloved senior from another college in the same city. So, Dr. Anup Gupta, welcome and.
Sir. Thank you very much. Dr. Anurag, really you are doing very good. And I have attended a few of your seminar just requested by Mr. Piyush, and he has provided me the pass at that time. Really, I'm very grateful to you. I have learned that you are working very hard. This is good that both of you are joining hands and giving all the doctors who are listening to you and patiently going to you and have a little bit worried as always there that पता नहीं मैं ठीक होऊंगा कि नहीं होऊंगा, मेरे को कोई परेशानी, भाई शुगर एक बार जब ज्यादा हो जाती है, मेरी मदर को भी ये परेशानी बहुत साल हो गए, मैं उनको बहुत कहता हूँ कि आप मम्मा आ जाओ, बट शी इज वरीड, बोले नहीं अब बेटा मैं ठीक नहीं होंगी, तू छोड़ इन सब चीजों को, मेरे को यहीं रहने दे, आराम से घर में ही रहना है मुझे। तो मुझे बहुत अच्छा लगता है। एंड टू दोज पीपल हु आर सेइंग कि भाई आप एलोपैथी से हो, हम आयुर्वेदा से हैं, अल्टीमेट मुझे लगता है हमारा जो ध्येय है वो ये है कि ह्यूमैनिटी की हमें सर्विस करनी है। हमें ये सब चीजें, बहुत छोटी चीजें हैं, इस तरह को हम सोच के लेके चलते हैं। और आपने कोई रिसर्च करी है तो बॉस ये अच्छी बात है, और अगर मैं उस चीज को नहीं कर पाया हूं और मैं अगर आपसे सीख रहा हूं तो उसमें गलत क्या है? आप जूनियर हो इसका मतलब ये थोड़ी ना भाई कि नहीं मैं आप पर कोई अधिकार रखता हूँ। पीयूष इज वेरी जेनरस कि भाई इन सब चीजों को वो मतलब बता रहे हैं, बट आई थिंक कि ही इज डूइंग वेरी गुड। और ये सब चीजें होनी चाहिए, अच्छी बात है। अगर आप सर्विस कर रहे हो, गलत क्या है उसमें भाई? और उसको थोड़ा सा ये है, कुछ लोग कहते हैं साहब महंगा बहुत है, बट डायबिटीज तो बीमारी ही बताते हैं कि भाई बड़े लोगों की है। टच वुड अभी तक हमें कोई प्रॉब्लम नहीं है, बट इन सब चीजों को कहना बहुत आसान है, बट जो आपका हार्डवर्क है, जितना आपने रिसर्च किया है, और मुझे लगता है आपको भी बहुत सुनने को मिला होगा शुरू में, डॉक्टर अनुराग से मैं बोल रहा हूँ कि भाई यार कहाँ तू ये जड़ी बूटियों और घास पत्ती के चक्कर में पड़ रहा है। इट इज ऑलरेडी ऑलवेज देयर। इस तरह के लोग होते हैं, मैं मना नहीं कर रहा हूँ, लेकिन हमें इन सब चीजों को छोड़कर जो आप सर्विस कर रहे हो, मुझे लगता है उस चीज को आगे बढ़ाना चाहिए। पीयूष से मेरे ख्याल जब बात हुई थी, उन्होंने जब ये जूम शुरू किया था, एंड आई टोल्ड हिम एट दैट टाइम कि दिस इज वन ऑफ द बिग लीप एंड कोरोना हैज हेल्प्ड हिम अ लॉट। लोगों के लिए कोरोना एक तरह से वो बन के आया है जिसको बोलते हैं कि भाई हमारी घंटी बजा दी है, और पीयूष की वाकई में इन्होंने घंटी नहीं घंटा बजाया। दिस इज गुड फॉर हिम। और ये एक बहुत बड़ी बात है सर कि एक प्लेटफॉर्म पर लेकर आना, अपनी कोशिश करना, और लगातार लोगों ने हैरास भी बहुत किया ऐसे, मैं जानता हूं, बट टू बी वेरी फ्रैंक ही डिडंट लॉस द होप, और उसने बहुत मेहनत करी है। आई रियली अप्रिशिएट हिज हार्ड वर्क, अप्रिशिएट हिज पेशेंस, कि सुनना, उसको इग्नोर करना, फिर अपने काम में लग जाना, ये बहुत बड़ी बात है। हम लोगों में उतना उस समय नहीं था, टू बी वेरी फ्रैंक, बट रियली ही इज ब्लेस्ड विद ऑल दीज थिंग्स। हमारा पूरा सपोर्ट है उसको, और हमें चाहते हैं कि भाई वो इस तरह की सर्विस को आगे अच्छे तरीके से करे। डॉक्टर सुदीप को भी मैंने सुना, डॉक्टर वरुण को भी मैंने सुना। ये चीजें सर प्रैक्टिकल जब सामने आते हैं तो लोगों का हौसला बढ़ता है। और आप अगर ह्यूमैनिटी की सर्विस कर रहे हैं, वो भी एक उस डिजीज में जिसका मॉडर्न के पास कोई परमानेंट ट्रीटमेंट नहीं है। एंड आई हैव लर्न्ड वन ऑफ योर पेशेंट जिसकी दादी थी वो 70+ की, एंड शी सेड कि भाई वो मेरे को भी वो आशा नहीं थी कि वो उनकी परमानेंट छूट जाएगी, और उनका बिल्कुल शुगर नॉर्मल आ गई एंड नाउ शी इज टेकिंग नॉर्मल डाइट। तो ये बड़ी बात है सर। रियली ठीक है, थोड़ा महंगा होता है, ठीक है, उसमें कंप्रोमाइज नहीं करना चाहिए, क्योंकि हम क्वालिटी पे कंप्रोमाइज नहीं कर रहे हैं। और अगर हम क्वालिटी पे कंप्रोमाइज नहीं कर रहे हैं, रिजल्ट हमें तभी मिलेंगे। इसमें कोई दो राय नहीं सर। थैंक यू वेरी मच फॉर यू एंड फॉर पीयूष ऑल्सो। थैंक यू पीयूष।
Thank you, boss. Thank you so much for your support, and it's always motivating.
डॉक्टर कुछ बोलना चाह रहा था।
Yes, yes.
एक्चुअली क्या है ना, देखिए डॉक्टर अनु, आपने बोला है कि महंगा ट्रीटमेंट है, ये मैंने बोला इस बात को, महंगा ट्रीटमेंट है, बट अगर हम टोटल कॉस्ट देखें कि कितना लाइफ में चेंजेस आते हैं, वो उसकी उस हिसाब से कॉस्ट बहुत सस्ती पड़ती है।
दैट इज माय पॉइंट, दैट इज माय पॉइंट। मैंने भी यही बोला
आपको कि कहा हम इतनी महंगी दवाई खा रहे हैं जो मंथली ट्रीटमेंट इतना, बट ये कि अगर देखा जाए, अगर ओवरऑल कॉस्ट दिखाई जाए कि 15 साल का जो ट्रीटमेंट मैंने मेरे फादर ने लिया है, उसकी वजह से उसके एवज में जो ये ट्रीटमेंट मैं ले रहा हूँ वो बहुत सस्ता पड़ रहा है।
यही मैं बता रहा हूँ सर।
दूसरी बात कर्क्यूमिन की मैं बात करता हूँ। कर्क्यूमिन मेरा खुद का एक्सपीरियंस है, जो डॉक्टर अनुराग ने नहीं बोला होगा, पर मेरे फादर ने कर्क्यूमिन कैप्सूल लेना स्टार्ट किया और विद इन 15 डेज उनके चेहरे पे चमक आ गई। ये और मैंने बीच में शायद कुछ बंद हो गया था, कुछ शायद कोविड की वजह से कैप्सूल की सप्लाई बंद हो गई थी, तो बीच में बंद हो गया था, फिर इसको दोबारा स्टार्ट किया और आई एम वेरी हैप्पी विद दिस कर्क्यूमिन कैप्सूल। थैंक यू डॉक्टर अनुराग।
दिस इज व्हाट आई एम सेइंग। मैं वही कहना चाह रहा हूँ सुदीप जी कि जब हमारी लाइफ या पेरेंट्स की लाइफ नॉर्मल पर आ जाती है तो फिर चीजें अलग हो जाती है। वो जो खुशी उनके चेहरे पे देखने को मिलती है, भाई ठीक है, हमारी नॉलेज है, हम उसको यूज कर रहे हैं। बट डॉक्टर अनुराग बिल्कुल सही कह रहे हैं कि किसी मेडिसिन की आप पोटेंसी पे तो ध्यान नहीं दे पा रहे ना। वो पोटेंसी इंपॉर्टेंट है। वो चीज अगर आपकी पकड़ में आ गई या लकीली आपको अच्छी मिल गई, यू विल गेट गुड रिजल्ट्स, नो डाउट इन इट। ये बात से मैं पूरी तरह सहमत हूँ।
Sir, one point that just one thing I would like to share before I would conclude. Sir, most important, like what you shared, Dr. Anup and Dr. Piyush has shared, is that we must have an open mindset.
Yes,
so
yes.
I'll share an incident about a cancer patient that I was having. So I was giving capsules of graviola to that person, but I had sourced that graviola. In India में लोग अपने फार्म हाउस में भी ग्रेवियोला ग्रो करते हैं। तो इंडिया में बेस्ट ग्रेवियोला क्वालिटी हैदराबाद में आती है, एशिया के अंदर बेस्ट आती है मलेशिया के अंदर, एंड वर्ल्ड के अंदर बेस्ट आती है अमेज़न रेन फॉरेस्ट साउथ अमेरिका के अंदर। सो आई वाज एबल टू ग्रेवियोला फ्रॉम साउथ अमेरिका एंड गिव इट टू दैट पेशेंट। सो उसने अपने ऑन्कोलॉजिस्ट से पूछा, तो ऑन्कोलॉजिस्ट का उसको ये जवाब था कि अगर जो आप ये लोगे तो हम कोई गारंटी नहीं लेते। तो अब बताओ,
दैट इज बैड।
No, तो फिर he came back to me because he was in his final stages. तो I said कि ठीक है, आप मत लो, आप उससे ये पूछ लो कि अच्छा अब हम नहीं ले रहे, आप गारंटी लेते हो? आप
सही है।
So that was one. Number two is that in allopathy also, towards end stages, doctors as a last resort they recommend immunotherapy.
No doubt.
What is immunotherapy? Immunotherapy is homeopathy only. Immunotherapy is homeopathy only. But we are not educating. We should have an open mindset in which all pathy should get together, and on a situation and a clinical requirement of patient to patient, we should give the best possible solution to that patient, irrespective of wo kaun se pathy ka solution ho. That is the approach from which I proceed with all my patients.
सर मैं एक चीज को कहना चाहूंगा, टू बी वेरी फ्रैंक, मैं होम्योपैथी, एलोपैथी और आयुर्वेदा में कोई वो नहीं। और मेरी जब इंटर्नशिप चल रही थी तो मेरी इंटर्नशिप एसएनएमसी में एसबीएच में रह रहा था मैं। आप समझ लो सर, डेली बहस होती थी मेरी। वहां 8-8, 10-10 डॉक्टर बैठ जाते थे और वो सिर्फ एक ही बात कहते थे, मतलब आई डोंट नो वेदर लेडीज आर आल्सो देयर, दे स्टार्ट अब्यूजिंग मी कि साले तुम लोगों ने हम लोगों को ना बस हालत खराब कर रखी है, तुम लोग ऐसे करते हो, तुम लोग वैसे करते हो। देन वी स्टार्ट चैटिंग अगेन कि भाई आप देखो। तो मैं ये कहना चाहूंगा सर कि आयुर्वेद अपने आप में कंप्लीट साइंस है। मैं ये नहीं कह रहा हूं कि एलोपैथी बुरा है। एलोपैथी को एक सबसे बड़ा रिजल्ट जो मिला है वो इस वजह से मिला है कि वो क्विक रिजल्ट देती है। आप पैरासिटामोल खा लो, 15 मिनट में आपका फीवर, 10 मिनट में आपका फीवर डाउन हो गया, पेशेंट फील बेटर, ठीक है भाई। बट उसके जो साइड इफेक्ट हैं वो कौन देखेगा? अच्छा, वो ताकत अब वो रही नहीं है कि जो पुराने टाइम में थी कि 6.5 फुट का आदमी है, वो दिन भर चल रहा है, 25 मील चल रहा है, 30 मील चल रहा है। अब वो चीज नहीं है सर। तो उस हिसाब से हमको ये भी देखना पड़ेगा। और आयुर्वेद जो आप कह रहे हो ना सर, इम्यूनोथेरेपी जो है वो होम्योपैथिक है। मैं इसमें करेक्ट कर दूं सर, अगर आप आयुर्वेद के आप जो पहला ही श्लोक है ना, उसमें सीधा सीधा है स्वस्थ स्वास्थ्य रक्षण मात्र विकार प्रशमनम च, उसमें और कुछ है ही नहीं। तो स्वस्थ के स्वास्थ्य की रक्षा करना अपने आप में इम्यूनोथेरेपी है सर।
Yes, absolutely. And thank you, Dr. Piyush. You've shared the links of the
Yes.
clinical trials of curcumin with coronavirus. So I was just wanting to.
Thank you.
Yes, and we have also shared the. Actually, there was a repeated request, and we are very much thankful and openly. Dr. Anurag has shared the ingredients from his internal file. In fact, you can see, and I have shared that
Thank you.
screenshot also with all of you. So you can download that picture and see all the ingredients. And as I said initially, I don't have that much of time. But if you, any one of you, is having that much of time and that much of bandwidth, or maybe availability of good quality raw herbs, why not? You can create your own formulation. You have the formula now revealed by Dr. Anurag. So please have it on your own, and you can do it. The only request we are doing is, if you want to get results as Dr. Nag is getting, the hard work and the pain he has done for obtaining the best quality raw material with the best quality herbs with the maximum potency. If you are able to do that, you can go ahead, and otherwise you can connect. And he is offering very good discounts also for doctors. So maybe you can directly take it from him as well. By the way, we are not involved in any aspect as far as dealing, as we promote all the companies. All the doctors are directly dealing with the companies and with the products. We don't operate on the commission model or any that kind of stuff. So whatever the dealing you people will be doing, you will be doing directly with Dr. Anurag. As Dr. Sudeep, he is my senior, so he's dealing directly with Dr. Anurag, and in fact, we don't have any intervention in that. So that is the model which we all are following, and we request all of you who's interested, please connect to Dr. Anurag directly. Dr. Anurag, if you have a few minutes, couple of more questions we want to
Sir,
discuss
I
with.
can take just one or two questions. Then I need to be somewhere else in another 5-10 minutes.
No problem, no problem. I can understand your schedule. So what I do is, I think we have shared the details of Dr. Anurag with all of you, so you can maybe directly connect with him. So just one important question I want to take it, and then maybe we can conclude this session. Many doctors have asked about the dairy products. Many doctors have asked about the dairy products, milk and other dairy products, how they have to infuse, or maybe how, what we need to avoid and what we can take as far as diet is concerned. So you can.
Sir, as such, regular or as a practical tip, I advise that my patients can only take almond milk, paneer, and milk products as such. The pure milk and milk products as such, उसको थोड़े से टाइम के लिए अवॉइड करना है। पनीर की जगह मैं बोलता हूँ टोफू खा सकते हैं। मिल्क में थोड़ा सा वो बादाम का दूध बना लें, उसको थोड़ा सा जो इफेक्ट दैट milk and milk products have to reduce the efficacy of Ayurvedic medicines. So even these herbs are no exception to it. So for the initial 2-3 months and few months, depending on patient to patient, so we need to reduce the usage of milk and milk products. In place of paneer, we can have tofu. And जब भी दूध लें थोड़ी क्वांटिटी में लें and almond milk के रूप में लें, that will be better.
Right, sir. Thank you so much, Dr. Anurag, for your time today. And
Thank
we
you.
are very much thankful and grateful to you that you pulled out some time from your busy schedule, and we can understand. And I thank all the doctors. By the way, all the certificates are right now available on our website. Few are pending, which we'll be uploading by today or tomorrow. So you can just log into the website and pull out your certificate. You can just type your name and your certificate will be there. So you can download. I request please try from a laptop or desktop. We have shared the link of exclusive WhatsApp group in the chat box. We are getting some more requests regarding the ingredients or more details. You have our contact details, our email ID info@indianvedyas.com, and I'm just quickly sharing the number also. So for further any clarification, just write to us, just mail us. And the entire session was live on YouTube, and it will be available on YouTube channel. Many doctors are asking that they have joined late, so you can watch the entire session on YouTube. Please subscribe our YouTube channel and also like our Facebook page. And we will be definitely requesting Dr. Anurag to have sessions in future. There will be a dedicated session on type 1, there will be a dedicated session on type 2. This was just an introductory session today, and we will have more diseases, we will have understanding on more diseases, and all the doctors who want to collaborate and work together with Dr. Anurag are welcome, and you can directly be in touch with him. So for your patients, for your family, you can start the treatments, or for your collaboration point of view also, you can collaborate with them, and they have some more very good products. I want to mention one product which I'm exhaustively using these days is their weight management product. I started with a lady with 135 kg, and I can say that he exhausted all kind of weight management program, and within 1 month of the product, she has lost around 6 kgs, and more significantly, the waist size is very decreased, and she's able to wear her old dresses also. That was the feedback which I got, and tremendous results for the weight management product. So there are so many other treatments Dr. Nag is having, and we would like to invite him in future sessions also. And I request all of you to be in touch with him directly, and you can collaborate and work as a close associate with them as well. Thank you so much for joining in today, and thank you, Dr. Anurag. Thank you, Dr. Sudeep, Dr. Anoop. Thank you so much for your time.
Thank you.
Have a great evening, and happy Independence Day well in advance to all of you. Have a great Independence Day to all of you. Thank you.
Thank you, sir. Thank you so much.
Thank you so much.